Welcome, everyone. Well, thank you so much for being here. We really appreciate your attendance. Today's session, Health Professions Educator, Health System Science session is going to have some of our Virginia Tech partners presenting. Our main presenter, Dr. Hannah Scherer, is an associate professor and extension specialist in the Department of Agricultural Leadership and Community Education at Virginia Tech. She's joined today by the following session facilitators: Matt Norris, who is a PhD student in the Department of Agricultural Leadership and Community Education; Dickson Otieno, PhD student in the Department of Agricultural Leadership and Community Education; and Kasey Owen, who is a master's student also in the Department of Agricultural Leadership and Community Education. Dr. Scherer, I'll now turn things over to you.
So Matt Norris is actually in engineering education. So just a clarification on that. And we came together as a facilitation team because I teach a course called Systems Thinking, Pedagogy, and Praxis. And so it's really thinking at more of a process level of how do we understand systems thinking and how do we help people become systems thinkers in lots of different contexts. And so the students that are helping facilitate today were all in that class in fall 2021. So it's really great to be able to continue to collaborate with them. So today we're going to be really scratching the surface on this idea of how do we develop systems thinkers and couch this in the idea of effective instructional design. I know that's something that you all are really interested in, and we're really going to just start to think about some strategies. And so my goal with this today is really for you to leave with more questions than you have now, and lots of ideas for thinking about moving this work forward. Some of the objectives, as I said, these are really, we're going to get started on these, being able to describe some approaches to instructional design for systems thinking, and then strategies for supporting systems thinking in your own instructional context. And we're going to do that through some breakout room discussions after some brief framing in the way that I like to think about some of these things. Throughout the presentation, I've put references on the slides, as well as several kind of starting point references, resources at the end. So, and I've tried to choose those citations to be good entry points for the topics that we're discussing. So if there's pieces that are new to you, I would encourage you to seek out those resources to get going on that. To start with, I'm going to talk a little bit about the way I like to think about instructional design. It's an entire field of study, and some of you focus on this, some of you may not really think about it at all. I like this idea of grounded design, which is really that we have learning environments, and there's a lot of different things that are at play there. We have kind of psychological learning theory, what's going on in our understanding of how learning occurs. We have pedagogical foundations. How do we understand that teaching and learning process to operate, and what are some of the kind of philosophical pieces that guide those decisions? We have technological considerations, there's pragmatic considerations, which I know in medical education is a huge part, and then cultural. And so grounded design really says that, like, for good instructional design, all of these things need to be simultaneously aligned. They need to make sense. We need to consider the tensions between those and really seek to have all of those things be congruent so that we get powerful learning environments for our learners. So that's, where when we're contextualizing this within systems thinking, I really like to kind of think about all of those pieces. And today we're going to be focusing more on the psychological and pedagogical pieces. Another way to think about instructional design that I find really powerful is this idea of backward design, which is really fundamentally, we're starting with the end in mind. So what is it that we want learners to be able to do? Who do we want them to be? What are our 5 to 10 years from now? Where do we want them to be? What are those desired results at both the big and small scale? From there, we think about what's the evidence that's going to tell us that they've achieved those results? And then we think about planning those learning experiences to get them there. And this is really, I have the arrows in both directions here because it really is iterative. And in the end, we want all of these things to be supporting each other and make sense. For today, we're going to focus on the desired results. And the way I think about learning outcomes, and again, this is guided by Wiggins and McTeague's backward design framework, thinking about different types of learning outcomes. So transfer, what kinds of complex tasks do we want them to be able to do? And I think of systems thinking as really a transfer goal. It's a complex task that they should be able to apply systems thinking in lots of different complex systems environments. What is the meaning that we want them to make? What are those overarching conceptual understandings? What's the factual knowledge? So this is getting into the smaller scale that will help them make meaning. And then what are those discrete skills that they're going to need to build together to accomplish those tasks? So again, if you don't think about learning outcomes a lot, this is a great starting point. And just this is the way as you're in your breakout rooms and thinking about different types of outcomes, these different ways to think about those, again, they all support each other. So getting into systems thinking itself, and I've been looking at some of the resources in terms of health system science, and I think that Donella Meadows' framing of what a system is consistent with what I've seen in some of the work you all are doing. This idea that a system is an interconnected set of elements. So there's things there, right? And they're interconnected in some way. And a lot of the conceptual understanding is about how are those things connected? What are the processes? But then what makes it a system is really that those elements are organized in a way to achieve something. There's a goal there. And we're talking about design systems, it's a well-defined goal that somebody set out to do. And we're talking about something more like biological systems, you know, that goal is to keep that thing alive. And so that's the way we can frame kind of at a high level what we mean by a system. And then if that's how we're thinking about a system, then systems thinking really is a set of habits of mind that can lead to mental models of complex systems that are closer to the real world. And I put real in quotation marks because often when we're dealing with social systems, there's even different perceptions of
so
reality
glad you guys showed up.
that we need to
Like,
take into consideration.
Here.
Oh, okay. And so this framing of systems thinking is really, how do we approach the world? How do we approach complex systems so that we can better uncover the complexity there? And within the US educational context system, this is typically framed as a kind of a deficit in learners are challenged in systems thinking. But that's, you know, socially and culturally mediated. There's a lot of different cultural groups where that systems thinking is part of their worldview and part of how people are raised. And so it's important to kind of think about that as we're thinking about what's challenging about systems thinking and what supports do people need. But often when prompted, the research shows that people can and will draw those connections and they can develop as systems thinkers, but it may not be their default way of thinking about a problem, and it needs to be explicit. So if the goal is for people to develop these habits of mind, often and I would assume this is the same in health system science, when I work with folks that are trained in science, we have this idea of systems thinking versus systems science. And often people will default to a systems science view and equate those two things. So I just wanted to tease those apart a little bit, that, you know, being able to describe a system in its complexity isn't necessarily the same thing as systems thinking as a transferable skill. You need systems thinking to be able to develop a complex map of something, but it may not, but actually being able to describe a particular system is not a transferable skill. So this is just an example I pulled that's a system map of obesity. And so we're not going to unpack this, but you can see how there's a lot going on here, and you might zoom in on one of these things like individual psychology, if that's your discipline, and your learners might be really focused on understanding those pathways within that particular part of that. But what we want them to be able to do is say, okay, if I'm seeing these different elements and these are connecting and these feedbacks are happening, where do I see that pattern reproducing in food production? Are there similar patterns of how these things are interacting in a totally different system? And that's where we can start to think about systems thinking as something that it's a way of approaching a problem versus understanding all of the nuanced systems, complex systems connections within a particular problem space. And so I really encourage you to zoom out and think about what are those transferable pieces that we hope that learners would then, when they enter a new environment, a new problem space, that they are looking for those types of systems-based patterns. And then to complicate things even within systems science, there are lots of different approaches to how scientists look at systems. And this review paper that I've cited here in the references at the end of the presentation, because I wanted to put it in kind of the suggested resources, it comes from designers, but it's a really nice overview and kind of literature review of different approaches to systems thinking that I find very accessible for folks that are new to this space. So we have within system science approaches to trying to understand those complex systems. And kind of, again, within a US scientific context, we really started with hard systems thinking, which comes from a positive perspective and this idea that the complexity of a system is knowable, right? Either we can design it the way we want, if we're thinking about computer science or some of those technological spaces, but also if we are aiming to predict how a system is functioning. So systems biology is another example, right? We know we can kind of assume that the body functions in a way that if we try hard enough, we can know all of those connections, all of those elements to be able to try to problem solve. So that's really hard systems thinking, is trying to understand that all of those connections, all of those things. And it from that perspective, when we start to move out of science and engineering spaces more into the social sciences, soft systems thinking is really extending that idea to acknowledge the social complexity of a system. And we can't really ever actually fully understand the system. We can't fully solve the problems, but we can use systems ideas and perspectives to really understand the different perspectives on a problem and try to manage it better. And so that's where I think the health system sciences really is probably aligning with some of those ideas. And then extending from that, critical systems thinking, again, is focused more on social systems and really addresses the idea of power in social systems. So really explicitly considering the perspectives of who's designing this system or who is the decision maker in that system and who's affected by that system, and is there equity in voice in that. And so I see that in some of the way within health system sciences, that seems to be very important when we're thinking about that broader social context that people might be bringing. And so these are just some ways to kind of unpack what we mean by systems thinking within these spaces. There's different skill sets in terms of how we might want learners to be thinking about these things. If we take all of that framing, as I said, it's a lot to start with. Some things to think about as you're thinking about translating those ideas into your instructional context. And by that, think about it, whatever makes sense for you as you're discussing this in your breakout rooms, be activities, assessments, projects, whatever other clinical environments. I don't know a lot about medical school, so you all use your expertise there to broaden that frame in terms of the spaces that our learners are in. But some things to think about, going back to that idea of keeping the end in mind, we really want to define learning goals to both the content that you're needing to teach, but also the process, and really thinking about what are those systems thinking skills that will really be addressed in this learning environment, and define those, have a separate goal or have it explicitly part of your learning goals, because that's how we get to them thinking about it as that transferable skill. And then, as I mentioned, right, there are many different ways that we define systems thinking and what skills are important in different spaces. So really consider how it's used in your disciplinary or interdisciplinary context. So get specific about it. It's not just like vaguely interconnections, right, when we get down into the way that we're thinking about it. So spend some time thinking through that, especially with colleagues. Identifying points of confusion and how you're going to plan to break them down. When we have these very complex systems with, spaghetti maps of ways that things are interacting, that's tricky for learners, right? And so thinking ahead for how you're going to break those down. Scaffold systems thinking concepts along with other concepts. So again, related, if you have your learning goals and both of those are there, then really thinking about that in your learning environments. How are we going to build those systems thinking concepts along with other content? And then finally, research shows that we really need to use systems language explicitly. So if feedbacks are an important concept, for example, those operate the same no matter whether we're talking about a thermostat or homeostasis or flow of information in like an information management system, right? This idea of positive or reinforcing and positive and negative feedback loops, right? That if we use that language explicitly and break that down while we're learning about homeostasis, then students or learners might be able to recognize, oh, I see this as like a runaway feedback in this other space. And so using that language explicitly can really help with those transfer abilities. So before we send you out to chat about these things, I just wanted to bring up some things that are a little bit more specific to the health system science piece that you all are working with. And as I look at this, some systems concepts that stand out to me, which I encourage you to keep building on this, but that may be important and or challenging. The idea of scale, right? You're dealing with patients or even like a particular system in a patient, right? All the way up to like healthcare policy, right? So that idea of how do these things interact at different scales is a really important concept to consider, and where, especially cross-curricularly, as you're teaching in different pieces of this, like how do we help learners understand how these things operate at different scales? You also have multiple interacting subsystems, right? Just looking at this wheel and all of the different pieces that are on here. There's lots to understand at the subsystem scale, but then how do these things interact and inform each other, even if somebody is working in a particular subsystem? The idea that in complex systems, we can have multiple causal factors influencing one outcome, whether it's a breakdown of information or a disease presenting in a patient, that they're unpacking those multiple factors that could be influencing one thing that we're observing is a really important complex systems concept. And then this idea of dynamic systems, right? That systems are always changing. A new policy, right, can completely change how we're operating at the health system scale all the way down to people over the lifespan. So this idea that systems are constantly changing. So those are just some pieces that I pulled out of kind of the standard complex systems thinking abilities that may be relevant here. And then just to have everyone on the same page, that the World Health Organization has defined systems thinking in a way that's fairly consistent with what Danella Meadows has said and the way we've been talking about it, that it's really an approach to problem solving that views problems as part of a wider dynamic system. So we're contextualizing this particular thing in a bigger system. So it demands a deeper understanding of the linkages, relationships, interactions, and behaviors among the elements that characterize the entire system. So again, we're looking at what are these things, how are they related, and using that approach to solve problems. So I think that if we're bringing all of these pieces together in that way, it's helping to kind of develop practitioners and learners that are really in that kind of health system science mindset. So with all of that, there's lots to think about, lots to chat about. We're going to have some facilitated breakout room discussions. And so if you have like burning questions, that you can bring them to the rooms. We all have been thinking about systems thinking for a while. But the goal is really to work with your colleagues to identify strategies for how you might support systems thinking in your own instructional context. So using some of the ideas that I've given you or anything else that you have from your expertise or experience. We have some questions that will start things off, but feel free to take that in a direction that's generative for the folks in the room. Making sure that everyone has a chance to share and get input as they're able on Zoom. I know some folks may be multitasking, so that's okay. If the conversation is going down a path and you feel like, oh, I want to see what other groups are thinking about, you're welcome to go back to the main room and get assigned to a new room. But also, well, yeah, the facilitators will make sure that everyone has a chance to share. So we'll be out in our rooms for 20 minutes. We'll end at 12:45. The facilitators will have a Google Doc that we'll take notes in so that the education team can kind of have a sense of what all happened there. And if anyone in the room wants to take notes in there, you're welcome to do that as well. And then what we'll do is come back at 12:45. Each of the facilitators will share one or two big ideas that came from the discussion, and then we'll have some time for a bigger discussion as a whole group. Welcome back. So what we'll do is have the facilitators just share out a few kind of big ideas from where the discussion went. And then we can open it up for any other comments that folks want to make, depending on what time we have left. I just have 2 more slides to share as kind of some closing thoughts. So I'll keep an eye on the time, and so we can have that discussion. And let's see. Dickson, do you want to go first?
Oh, yes, sure. So, so we had great deliberations in our group, and the issues that I saw come up very clearly were issues around like having the end in mind. That is very helpful in systems thinking. Just having the end in mind and then working backwards to address all the issues that are there. Then those issues around interdisciplinarity of systems thinking. You might not be in a position to address everything at that point, at any given point in time. That's why we borrow from each other and then learn from one another in a systems approach to address these issues. Interdisciplinarity also brings issues around diversity of perspectives. So those are some of the key issues that arose out of the meeting that we had. Just have an interdisciplinary approach, have the end in sight, and then work backwards. That would help build the system. Thank you.
Awesome. Kasey, how about your room?
Our group also had a very interesting discussion. Question 4, I think, was where we got some really unique ideas, especially around from Jed on just employing the tools and approaches to systems thinking and how those can be difficult challenges, but that if you come in with certain skill sets or characteristics like humility and being humble enough to know that you may not know something, or you may be making assumptions, that can really assist with this, leaving those assumptions at the door, and how important this prerequisite is to becoming a physician or working in this field, having a growth mindset, and actually practicing that. And then just kind of thinking about like the wheel, the image, that there's so much involved and included, and how do we incorporate all of these various elements into thinking about curriculum and instructional design, and at what level, and thinking about, is this for a student, is it for a resident, is it for a faculty perspective, and kind of tailoring it to that as well. So those were some of the high level overviews that I thought were interesting to highlight from our group discussion.
Awesome, thank you. How about you, Matt?
We had, as everyone said, good discussions. A number of the points that Kasey brought up, really trying to get at that holistic view. Our discussion went a slightly different direction, though, and people talked quite a bit about opportunities and some changes that have been happening. Changes, I believe, the next gen RN examination, and COVID is a case study essentially for really diving into how these systems works, and talked a lot about opportunities that are kind of already present in, someone mentioned that they are already teaching interns the economics of where you order a prescription or tests at different locations can impact how that will impact the patient. And perspective taking as well showed up the idea of trying to approach a problem or issue with that sense of humility and inquiry, and looking at the issue from multiple perspectives of those involved to really kind of have the best, teamwork in terms of quality and safety, all popped out from our discussion.
Great. And our group, we spent a lot of time talking about kind of the different systems approaches and kind of how systems thinking is already used in a lot of the context. And we had a really interesting discussion about whether hard systems or soft systems or critical systems applied. And it seems that, they all apply in different spaces, right? When we're talking about like the actual physical systems and how things are operating, and understanding like the physics of light, if you're trying to understand the eye, right? So there's definitely hard systems things there. And then moving into, people are, this idea of soft systems, and there's, but we need to think about critical systems as well. And so we had people from lots of different disciplinary perspectives. And I think it was really important to have that discussion around these different types of systems approaches. And what I was hearing was that, we should have learners be able to understand all three of those and the differences and where they're showing up and how those are intersecting as we move through different parts of the health system, So I thought that was really interesting. And that's something I love to think about and just from my work. And then really some really great examples of kind of how are we already doing this in terms of case examples and ways that people are thinking about this, differential diagnosis within nursing. And, there are a lot of these processes already really being reinforced in the teaching. And then this idea of interdisciplinary teams coming together to solve problems like diabetes, right? That there's really a lot going on there. So really generative discussion around kind of what do we mean by systems, and what types of systems are learners likely to encounter. So it's always interesting, these discussions go in lots of different directions, which is great. So one of the things that I know is important as we're thinking about systems, trying to develop systems thinkers across all of these different spaces that you all are trying to help people learn. Matt had shared this paper from some authors in your field, this idea that being a systems-minded practitioner or educator requires the development of a new professional identity as much as knowledge acquisition. It also involves an expanded mindset that necessitates caring for and addressing insufficiencies in the system as obligatory aspects of the professional role. And so I heard a lot of that in all the breakout rooms sharing that this is important, this is where we're headed, and it's what we are thinking about in terms of who people are as a professional. It is being able to see that system and diagnose that system, but also operate within that system. And so when I read this paper about this challenge of professional identity and some of the barriers to implementing health system science, it made me think of an author who's in a totally different space. Adrienne Marie Brown is a brilliant thinker that works more in community organizing and social change. And she's her book, Emergent Strategy, really takes ideas of complex systems from nature and applies those to thinking about organizing. And so one of her factors, or one of her strategies within Emergent Strategy, is this idea of fractals. So I thought this might be helpful to you all as you're thinking about staying motivated to work through the challenges that you're all going to have to face in terms of how do we help people see this whole giant thing. She says, how we are at the small scale is how we are at the large scale. The patterns of the universe repeat at scale. There's a structural echo that suggests what we practice at a small scale can reverberate to the largest scale. And I was thinking about this as like what we do to manipulate cells all the way to the health system, right? But who we are and how we operate really can build towards system change. And so as you think about the learning environments you're in, the upcoming practitioners that you're working with, this is something that just kind of resonated with me as I was thinking about today's session. So I mentioned there's some starting point references for you, and I'll stop sharing this and happy to take any questions or any further comments from anyone in the breakout rooms that you wanted to elaborate on. So folks, welcome to type in the chat or raise your hand, or if you're quick, start talking before anybody else does.
Hannah, I just want to comment about that because this is first time coming for the system thinking kind of interprofessional kind of a discussion. I love the initiation. I appreciate that. But how we implement each department, I love to hear that. And there's some successful story, some that would be helpful. Maybe this is a first session, but maybe you kind of consider maybe second or third, and then maybe some faculty from the different departments can kind of share some example. That would be very helpful for me to how to implement it.
Yeah, like I said at the beginning, this is just a starting point for sure.
Absolutely. If we also have lots of folks who would love to engage in this conversation with you. If you want to get a hold of us separately, we can have independent discussions on those types of things, and you can listen to varied discussions about separate examples for folks who are doing this really well. That was a great comment. Thank you.
If anyone has any other questions, feel free to put those in the chat, or feel free to take yourself off mute and ask those questions now. I believe we've put an evaluation link in the chat for you. Feel free to engage with that. We want to thank everyone for their time and being here and joining us today. Some of you probably have things that you need to jump off, but if not, feel free to stay and be part of the conversation before we close.
Enjoy your day, everybody.
Thanks for the opportunity. This was fun.
Absolutely. Thank you all for your time and the effort that you put into this presentation and facilitation. It means a lot for you to be a part of this conversation.